afternoon. Hi, my name is Dr. Janice Beal, and I'm your host this afternoon for Tuesday. I am excited to be here because I get to talk about something that I really have and hold passionate to my heart. It's mental health. And mental health, I think, is something that has actually trade places a lot of times with other types of health disorders because people really did not want to talk about mental health. So traditionally, we would often kind of sway away from the topic because of the fact that we did not want the stigma that's associated with having some type of mental illness. But I think since COVID, it's actually made a change as far as how our community actually visualizes or conceptualizes or thinks about what mental health is all about. So I think that even though we went through something several years ago, that was the kind of gateway to where we are today. So I'm really thrilled to be able to talk about mental health and what that actually means. And today we are celebrating the very last day of Suicide Awareness Month. So therefore, I think that's important because we need to start talking about these different disorders and talking about the different things that people are having to address so that we can be able to understand what we need to do. Silence is no longer an option. Having practiced for over 30 plus years and seeing so many clients that I can't even begin to talk about or talk about the things that they've experienced, I think it's really important that we understand that mental health affects all age groups. So whether that's children, adolescents, adults, senior citizens, at every age, we all have something that we have to deal with.
Absolutely.
I think the new term that the young people are using now is life be lifing. And the first time I heard it, I was like, oh my God, did they make a mistake when they wrote the alphabet together because it didn't look like it made sense.
Right.
But then I realized what it meant. And so that's their way of saying that things happen in life. And sometimes it affects our mental health. And we really don't understand what that is and how much it affects us. So today we're going to have a conversation about mental health. But here's what I've started to do. I've given so many lectures now that I changed the word mental health to mental wellness.
Awesome.
Because everybody wants to talk about being well, and it's more of an accepting term. So we will kind of end with what you can do, things that you can do, and who do you call. And we're going to each one with my co-guests this afternoon. We're going to talk about what they do and how they work through different areas that actually affect us as human beings. Trauma is one of the new buzzwords that's been around for the last several years, and we're always talking about trauma because everybody says, well, I really didn't experience any trauma. But that's not true. We've all gone through something, and you may not really understand how trauma has affected you.
Correct.
And how sometimes that is also, like we're going to talk about other things, connected to suicidal ideations and thought patterns. So please take a seat. Get your pen ready so that you can take the notes that we're going to share, the nuggets that we're going to leave you with, so that you can understand what is mental health and mental wellness and how do we address it as a community and as individuals. Let's first talk about the numbers, because I always believe, and for those who don't know, I guess I should tell a little bit about being in private practice for all this time, and also being a professor at Prairie View A&M University. I always like to add that to my repertoire of how many years I stayed at PV. But when we first started talking about the disorders and what that actually meant, I guess that was at the beginning of the DSM. And so we're going to go through and talk about depression and what that looks like. And as I introduce each person, and how do we know when you're in that space or when you need help. But when you look at the numbers and how we're affected in the African American community, if you were to count every 1 in 7 persons, they may suffer from depression. So if you're sitting next to someone and you go 1, 2, 3, 4, 5, 6, 7, it may be that person. So which that tells you is that depression and anxiety are not uncommon, and it can happen at any age.
Correct.
So therefore, it's important that we understand what that looks like so that people know there's a difference from being just depressed, and then there's a difference from being clinically depressed.
Correct.
And so as we go through talking about mental health today, we're going to give you some signs and give you some things to look at, and then we're going to talk about when you cross over to clinical depression or anxiety that needs to be addressed. Or even, we may even go to the point of actually talking about other disorders, but I think it's important that we understand the foundation of what most people are aware of. so that you can no longer be afraid when we're
Very
talking
good.
about mental health and mental wellness. So, suicide is the second leading cause of death for African Americans between the ages of 15 and 24 years of age. And when you look at that number, you're like, wow, how did that actually happen for that age group? Because people are saying, well, they're young, you know,
Right.
how are they depressed?
Exactly.
What does that actually mean to
Right.
have someone between 15 and 24? Life hadn't started yet.
Correct.
So I think the misnomer about what causes depression is important. And so I'm going to introduce my panelists for today. And we're going to make sure I talk to Miss DeMonica.
Not Dr. Yet.
Not Dr. Yet. Well, actually, I like to put it out there in the universe, okay?
Yes.
So you'll get there, okay. DeMonica Neal. She's a licensed clinical social worker. And Ms. Renetta W. Owsley, who is the owner of and is a grief coach. So I'm going to let them tell us a little bit about what they do, and I will jump in and out to kind of add a little bit. We're going to have like just a regular conversation, ladies.
Excellent.
And so through this conversation, it will be a learning phase for people to know. And so let's look at this age group, 15 to 24. Why do you think that would be the most common age group for the second leading cause of death? Because that also puts kids in college. And I do a lot of work on college campuses now, trying to talk about mental health and mental wellness and with organizations that I work with, so around the country. So I'm really excited for you to share that information with us.
Well, hello. My name is DeMonica Neal, and like she said, I am a licensed clinical social worker, therapist, and owner of Byway Counseling and Wellness Center. I have worked in various populations, from children in the schools and also children ages 3 to 18 in the therapy setting with their families as well. And I also work with adults ages 18 plus who experience anxiety, depression, life transitions, postpartum, anything pertaining to that, and antepartum and things of that nature. I just recently published my first journal, postpartum healing journal.
Awesome.
And so I didn't even say that. I've been in the field for about 10 plus years. And so my experience with especially the Black youth in this community, a lot of times we are to be seen and not heard. And that causes them to not be able to articulate their feelings when they are feeling a certain way. If they're crying, if they're expressing it, they don't know how to let it out. And then
Express
in this age group too, they're finding themselves, right? And so they hone into the community within the schools, and if they are outcasted, or if they don't belong, or if something goes viral, or something of that nature, that then their whole life is ended, and they don't know how to express that.
Absolutely.
And because they can't express that, they think, well, I have to keep this to myself. What can I do? How can I get rid of this?
Right.
And one of the things the easiest thing that people say is, well, I just won't be here anymore. I won't be a burden on anyone else. I won't, because of how they feel like they are this heavy burden on their family or their friends, and they don't want to be that for them anymore.
Right.
Even in this young age group, and that's what they decide to
Absolutely.
do. So.
Okay. I started with the first statistics, but let me talk about children that are younger than age 15. Because suicide rates among Black youth younger than the age of 15 is higher than white youth. So when I talk to parents and when I share information about what is depression and what does that look like, the first response that I usually get is the fact that parents will say, well, what does my child have to be depressed about? And why would they actually want to take their life? Well, one thing is that depression in children looks different than depression in adults.
Most certainly.
Because in children, we're expecting, or in adults, excuse me, we look at the fact that they're sad, they don't want to do anything any longer, they don't want to be around their friends, they start isolating, and all the things that you just described that happens with a teenager.
Absolutely.
But in children, depression looks a little bit different. It looks a lot like what we call ADHD, and everybody's like, wait a second, I'm not saying that your children are suicidal. I want you to please listen to what I'm saying.
Right.
Because they don't sit down and have conversations like what we're talking about when a
Absolutely.
child is between the ages of 7, 8,
Right.
or 9 years of age.
Yes.
Because they're not capable of saying, I really don't feel good, Doc. I really don't feel like I want to move on.
Right.
They may tend to take on things that we would try to think, when they want to be the person to help their mom in the household. If they want to be someone who actually is carrying the burden financially, if they think that they cannot help.
Right.
Or it could be a component of genetics.
Correct.
Okay, depression is something that we genetically can look at and see that it actually does exist. So it wouldn't have been if they would have chosen that they wanted to be depressed. Or a lot of times people didn't choose depression as one of their disorders or anything, really. It's the fact that when two parents came together, this is what happens genetically. And you start to look on the line to see what does that look like. And so that's why when we come for therapy for the first time, we ask family background.
Absolutely.
And people don't want to talk about their family. Most times, if the mom brings the child in, the mom will say it's the daddy's background. If the daddy brings the child in, he'll say it's the mom's background.
Exactly.
Because no one wants to be responsible. But it could be
Exactly.
both backgrounds when you really look at it.
Right.
And so it's not a blame game. It's a game of being knowledgeable about what happens in your family.
Absolutely.
And what you know to look at. So that's really important to understand not only your physical health, but understand your mental health history. Because once you understand that, you'll be able to, when you go in and sit and talk to someone, to be able to trace what could possibly be something that my children, or my adolescent, or myself, really. Because depending on which age group you're in, my age group didn't talk about anything. So if it was a problem, then
Oh,
you just had to stay in that house and try to deal with that problem by
Absolutely.
yourself.
Seen and not heard.
Seen and not heard. You was like, you
Yeah.
better not tell anybody what's happening outside.
Absolutely.
And if you do, it's going to be between me and you.
That's right.
And so it's so funny that no matter where I go, people still say that. And none of us grew up in the same household. But we made it seem as if it was something that was wrong with us. And
Yeah.
parents, I do want you to understand, it doesn't mean that something is wrong with you or something's wrong with your child. It just means that they have a certain thing. So if we had heart disease, I remember when cancer was not talked about.
Absolutely.
And people wouldn't talk about cancer, so now we understand what it is. That's how mental health needs to come. That's the kind of conversations we need to have, especially among our males and females, because I haven't done that statistic out yet about how many black males actually is twice as, the number is higher for black males than it is for females. So what do you think? What do you think? I've said a lot about children and adolescents and what that actually looks like, but on the back end, we're going to talk about what we do as therapists in counseling. But I kind of want you to talk a little bit about what you do as far as a grief coach, because once we get through the diagnosis component, or let's say someone has taken their life and the
Yes.
family is trying to deal with it
Absolutely.
and trying to understand what that looks like.
Yeah.
And grief is something that I tell you, if you don't work with grief, grief will get you, because you can try to
Yes.
hide as much as you can, but grief is
Absolutely.
there, and it happens regardless if we want to or not. So we can push it back to say, I'm not going to deal with it, and it'll be
It
3 years,
resurfaces.
Right.
and it surfaces, and it hits you like a baseball bat.
Right.
Absolutely.
Okay, because all of a sudden somebody could be saying something that's totally unrelated, and you start crying.
Yeah.
So we really need to understand the whole process from diagnosis, I would think, to
Absolutely.
actually treatment, to actually some alternative to treatment. And that's what I want you to talk a little bit about what grief coaching is about.
Absolutely. Good evening. My name is Ronetta Osley, and I'm the proud owner of the Gathering of Truth Grief Coaching, Inc. Okay? And the name came to me. Actually, I was praying what the Lord wanted me, because it's a business/ministry, okay? And if we don't address truth, and that's what the Holy Spirit told me, if you don't address truth, you'll never get to the root of the issue, okay? And that is where everything stems from, truth, okay? So, and there are so many facets of grief that people think it's only maybe just a mental health or a death. but it isn't. It's a loss of your job. It's a loss of real friendship. It's being not feeling good about yourself, your self-esteem, who you are, and how you project who you are. And so what I do, I help you find that new norm from either the grief aspect of the death in your family. And many people, my clients come for one thing, but it's totally another. And the truth factor is allowing you to define what it is that really makes you sad and being honest about it. And that's that mirror that we don't like to look at. That's that truth mirror that you have to search your heart. And I believe in journaling, because once you write it down and no one's around, no one's twisting your arm or whatever, and either you just foo-foo, but once you write it down and you go back and you see just what it is that brought you there. Maybe as a child, you mentioned in short, Doctor, that when we were kids in the old days, you were seen and not heard. I remember when my grandma died, my parents, they were all disturbed, and my mom was just out of sorts, and but they didn't ask us about our attachment and our relationship with our granny, who taught us how to cook, bake, sew, and when she would go fishing, help her clean the fish and all that. Those are relationships, and children, when you lose someone, and as you grow and not able to identify those losses, it becomes a character defect, because you're not able to say, okay, well, that person is gone out of my life, and understand the why of that. So so there are so many emotions there. So mental health, grief, and understanding that journey, then that's where I come in. I help you find your truth in what you're dealing with, because we all hold our truth, pretty much. It's just identifying it.
Excellent, excellent. I must say that I did not know about grief coaching, so thank you for sharing that with us today, so that as we talk a little bit further about the topic of death and dying and what that looks like, and talk about mental health, we will definitely want you to give us some of the pointers. You mentioned journaling, and
Yes.
journaling is also a technique that's used in counseling.
Yeah.
But the difference is the fact that the process
Yeah.
and how you process that information and what that actually looks like
Right.
as you go in and work with clients and patients. And I'm
Right.
assuming you do a lot of family work as well.
Definitely.
Okay.
There's an intake process, and finding out where they are in their grief,
Okay.
identifying. Yeah.
Excellent, excellent. Okay, so let's jump back a little bit, and let's just talk about depression. Okay? And we talked about the fact that children, adolescents, and adults can all suffer from depression. Now, I talked a little bit about the differences between children and how it sometimes will be mistaken for attention deficit disorder. And that's because, and I need to go back and explain that before I pass to Mike, is because children tend to act out when they're depressed,
Exactly.
which means they're not going to sit down, like I said initially, and say, hey, doc, I'm not feeling good.
Right.
I don't feel like I feel emotionally tired or something that's heavy on my heart. They're going to act out.
Yeah,
Kids act
yeah.
out what they're feeling.
Exactly.
So therefore, when they're acting out, people immediately start to give them, especially black males. And some research I did quite a bit of time ago, and we were actually looking at kids that were in the juvenile justice system, and one diagnosis that everybody had just kind of like overlooked was depression. And so we realized by testing them the fact that depression was real, and it was something that all those children had in common, as opposed to thinking that they were acting out because they were just behavioral problems.
Right.
So tell me some of the signs that people need to look for in depression, and what does that look like?
Well, it depends on the person. One particular set of people that's standing out to me right now, kind of pivoting away from children, is the strong friend, quote unquote, right? The strong friend takes on everybody's issues. Everyone comes to them.
Oh,
everyone
yeah.
talks to them. And then they feel like a burden if they unload on anyone else.
Correct.
And so they keep everything in, and they have to keep going, and they have to keep doing because they're the strong friend. But they never address what's happening within them
Correct. Wow.
because they don't feel like they have the outlet to do so. And so that can ultimately lead to depression, which can ultimately lead to suicidal ideations and thoughts because they don't want to be that burden on their family
Absolutely.
members or their friends or
Yeah.
anyone like that. So a lot of times they say, you know, check on your strong friends, check on your strong friends. But oftentimes strong friends say, oh, I'm fine. I'm
Always.
okay.
Yeah.
And
Wow.
so I always like to say, strong friends, when they check on you, speak up
Oh, that's
and
good.
say something.
That's good.
That's amazing that
That
you're
is
talking about strong friends, because every person, or as we have the superwoman syndrome in the African American community for females, where because we are so used to taking on
Right.
everybody's everything,
Yes.
and so therefore self-help and self-care. So we're going a little bit away, but it's going to all make sense to whoever's
Right.
listening to us
Right.
today. Self-help and self-care is something that we really don't practice.
Absolutely.
Because traditionally, and I'm going to go back to your story about your grandmother, I don't know how people did things and made things happen many, many moons ago.
Correct.
And they made it seem so easy.
Yeah.
They made it seem like, grandmother could go to work, she could work for someone else, she could come home and work in her own home, cook, clean, do all the things that needed to be done for the family. People would come to her, and she always had money somewhere to be able to hand
Yeah.
out. Today, if somebody
Yeah.
comes to me, and you probably need to wait till tomorrow, because
Yeah.
tomorrow is, I have some checks coming in the mail tomorrow, but not today. So,
They
and we
go to the
tend to
mattress.
take on those roles as
Right.
being a strong person.
Right.
And so on our jobs, it's interesting that our current, and I'm going to really jump out here, our current person who sits on Pennsylvania Avenue tends to think that the person he has to be afraid of mostly are black women.
Isn't
Because we're the
that
most educated person, and we're the people, if you want something done, they said that's who you need to call.
Absolutely.
And so it's amazing how we've taken on all of these things, and self-help and self-care is just something that we just did not talk about.
Right.
And learning how to do that, even for myself in the profession that I'm in, has been very difficult because everybody
Right.
wants to be strong. Well, the opposite of strong is weak, okay?
Absolutely.
So sometimes it's okay to be weak, because sometimes it's okay not to do it and to be able to say no.
Absolutely.
And there's strength and weakness.
It's
Most
strength and
certainly,
weakness.
Most certainly.
Because it's hard to say no.
Oh,
So you're showing your strength when you're able to step up and set that boundary and say no.
And that is a key word, boundary. Boundary settings are essential.
Okay, so
And- yes.
I'm going to ask you a question.
Yes.
I said, and I've been talking about, how do you say no? Okay, no is real simple because it's only two. It's only
yeah.
2 letters, right?
Yeah.
N-O. Do you
Right.
want to? No. Can you? No. Will you? No. I mean, if you start practicing it in the mirror, it'll become very easy, because that's something if we're changing our behavior,
right.
we have to change how we do things.
Right.
And so I think all of us, especially if you used to taking control, or if you're used to being in charge or something, can you do something? No. Will you? No. And it's
Correct.
almost, and then here's the thing, not feeling guilty
Absolutely.
when you
That's
say
the
it.
thing.
Doctor, and that's one huge advocate, as we say, nugget that I advocate to my clients is self-care and with those boundaries. It is not workable at all unless you practice and believe in that no. And for the better you, in order to be a better to somebody else. You can't be a good you to anybody in truth if you're not a good you. for yourself.
Right.
And I tell you in a minute, I love some meat. Okay? I love the meat. Okay? And I have to love me in order to love and respect you. Okay? And that is so vital, and it helps in the process of the journey in praying that those people don't get in those places of those depressive states, to understand that they have to love the God, man or woman of themselves. And it is so vital, you know. So, I mean, there are drugs that are needed to obtain, to get them to that place in their understanding. But once there is a common, you know, or what is it, something where it's, what is that area? Where they can understand the process better, that's where I come in. Okay. But we know that with mental health, you have to have a standard medicine sometime to help them.
You mean psychotropic
Psycho-
medication?
yes,
Oh, psychotropic
yes.
medications,
Yes,
yes.
most certainly, yeah.
Okay, and that's a whole different topic for our community as well. So we're really pushing you
Yeah,
forward.
we're going out there.
We're going to talk about mental health. We're going to invite it to come into our families, because we're going to look at our family history to see what is in our history.
Right.
We're going to talk about our traumas, and we're going to deal with the traumas and no longer put them in our rearview mirror.
Absolutely.
Then we're going to come and we're going to learn how to say no, because we're going to start
Yes.
taking care of ourselves. By the time we
Self-care.
finish today, you'll have a whole new person because you'll have all the skills in order to be able to move forward, to be able to be a better you, because
Yeah, you need to
that's
be a
something that
better
has
you.
to be taught.
Right.
Because traditionally, we're accustomed to doing what we always have done.
Right.
And whoever that person is, who is that strong person in your family, if you lean on them too much, they may not say anything to you because they still want to be in that position, and they
Right.
really may not even know that it's time for them to rest.
Absolutely.
Because a lot of times they keep pushing forward and forward, and so they're being the superwoman. And I say, it's time to take off that cape, because Superwoman and Superman.
Right.
Okay? Because it's almost like if you're being everything to everybody, like you said, and nothing to yourself, you never quite get to the other side
Absolutely.
to understand what life is. And what really gets me is when people retire and then they die.
Oh my gosh.
Because they've lived their whole life providing, giving, and doing things, and don't really understand what it means to stop and take care of themselves.
Yes.
So what does that look like? Because if I'm no longer strong and I find strength in my weakness, but then people stop coming to me, am I still worthy? Okay, so now we have the guilt that comes in when you start to
Right,
say, no, am
right.
I still worthy to be that person, to be able, because I still want people to come to me. I just don't want you to come every day.
Right.
Absolutely.
Okay. I want you to call and say, can I have permission? Can you talk to me right now? Do you have
Right.
time? And if you don't, I don't need to hear a sigh on the other phone. Like,
Absolutely.
okay. We can't talk. And so it's amazing to me how we want change to happen, but we have to embrace change, and we have to
Absolutely.
understand what change is about.
Right.
Yes.
And so I look and I talk about, now here's another ploy to part of what I've been doing, people who are caregivers,
Oh.
and the caregiver taking care of themselves.
Oh yes.
Okay,
Yes,
so
yes.
to me, that's an amazing process,
Oh, my God,
because we have been, I guess for the lack of better terms, groomed to take care of other people as women.
Mm-hmm.
So therefore, when it's time to take care of a family member or a loved one in our family,
Mm-hmm.
we push forward, but we still go to work every day.
Mm-hmm.
We still take care of our children sometimes, and so we're caught in that sandwich.
Right.
And we stop doing everything in life that would actually be something that we would be doing. So now we have caregivers as another group of women, primarily, who are not taking care of themselves because of the fact they're trying to live up to, okay, we're going back to grandmother. Because
Right.
that great-grandmother and that grandmother did so much, and how could I not be that person?
Absolutely.
But here's the thing, in the Bible, you will see where Jesus rested. Okay?
Absolutely.
And on the seventh day, and he also gained rest through a storm. There was a storm, and they wanted him to wake up. Now, mind you, I can't quote any scriptures, but I can quote the stories that I
Well,
hear.
we know the story.
And they wanted him to wake up, and he did not
That's right.
And he said, I will. And when he got up, he ceased the storm.
Yes.
So, which means that your emergency doesn't necessarily have to be my emergency.
Absolutely.
Okay.
Absolutely.
So I can call you back
Exactly.
when it's on my time and it's good. So
Right.
now we're all on a different level. We've talked about, I got to regroup because now we've talked about mental health and what that looks like.
Yeah.
We kind of, I think we need to also talk about anxiety a little bit.
Yes.
I think that those topics are things because we can give you a list of what to look for, but we want to make sure that you understand what you need to do and how that actually works. And then we're going to circle back to how we're going to end in our grief walk with being able to make sure that, so people who are ever listening, they say they're going to talk about everything. Yes, we are. Okay, and too bad you can't call in and ask questions because I think that it would be very helpful to be able to
It's all in
address some of the
same
things.
family.
That they allowed me to do that. So I may not be asked to come back, but I'm good. So I'm going to make sure I get as much as I can in today to be able to talk about mental health and how passionate I am about understanding.
That's great.
So tell us a little bit about anxiety. What does that actually mean?
So anxiety can look different for different people. Anxiety can be a lot of anxious thoughts kind of happening at one time. You kind of think about everything that you need to do, and then you kind of go from everything that you need to do to what you have done and what you got to go do, and then you just kind of get in this spiral
All
in
over
your
the
head
place. Yeah.
of everything that's happening, right? Anxiety can look like you've pushed off a lot of things, and you have been working and being that strong person and doing all of these things, and then something hits you, and then you have this attack, and you don't know what's happening. You can't breathe. Things are and all of these physiological responses are happening within your body because you haven't addressed the emotions.
Right.
So anxiety can manifest in different ways, both mentally and physically, and so it's important to acknowledge the thoughts that you have and not just kind of write them off as something that you've always done. I've always thought this way. I've always done things this way. This is normal for me, because that's anxiety, right? When you're stuck in that thought loop, you go down that wormhole and you can't kind of pull yourself back up.
Correct.
That's when you need to kind of address it and say, okay, look, I got to do something. I need to do something different because this anxiety is taking over, and I'm not able to show up the way that I used to show up. I'm not able to be there for people the way I used to be there for people.
Right.
I'm not able to pour into me
Right.
because I'm in my head a lot. Everything that I'm doing, I'm in my head, and I can't seem to get out of it.
Right.
Excellent.
Awesome.
Excellent. Do you want to talk a little bit about anxiety before I start?
No, you can go ahead.
Okay. So anxiety, a lot of times, of course, is one of the disorders that can also start in childhood and adolescence. And so I keep going back through the process because sometimes people think that it's only something that adults actually suffer from. And there are irrational fears that we have or we experience that can be caused by anything.
Right.
It can be caused by, once again, genetics.
Correct.
Where if your mom was anxious, that she also suffered from anxiety. So therefore, your grandmother or your father or whomever else, so now you appear to be suffering as well. Or it could be situationals type
Yes.
things, like having to speak in public. People have difficulty saying, I'm not a public speaker. I can't speak in public. Or being called on in a classroom. Or called on or asked to present something on your job. So anxiety has many roots, and it has a physiological type.
Yeah, I was gonna say going to new places, experiencing new
Oh,
things.
The dentist, oh my God, anxiety, yes, for sure. And I have lots of friends who
Take
are
my blood
dentists.
pressure, right? And then, I say, hey,
Yes.
I got to lay down for a minute and just relax my body, then come back at me.
Yes, so,
Yeah.
but those are the two most common disorders that we hear about.
Right.
And so we have like the fears, like agoraphobic, people who are afraid to leave their homes. We have
Oh
fears of
my
people that are
gosh,
afraid
yes. I
of
have
snakes
ones
and
like that.
spiders.
Yeah.
And fears are something that we learn about because as children, we're not really born with fears, but it's introduced to us.
Yeah.
So, for example, if something were to run across this floor right now, I may scream because I heard about it was going to bite when it bites you, a spider, and it's going to make you do all these other things. So now I'm afraid of spiders, and I wasn't afraid of spiders before
Right.
because I've never really been next to a spider,
Right.
but they look ugly, so I'm going to
Yeah.
be afraid, just like everybody keeps saying. So,
Right, gotcha.
and what we do in therapy is we help you process
Right.
how to reverse those fears. So, for example, if you're in a car accident, and so therefore now you're looking in your rearview mirror every time you go somewhere because you're trying to decrease the amount of anxiety that you're experiencing by actually experiencing something that caused the anxiety. But it can make you feel like you're having a heart attack.
Right.
Yes.
And so you'll go to the emergency room and they'll check you out. And then all of a
Exactly.
sudden they'll say it's nothing wrong, that maybe you need to see someone and talk about it. And then everybody will come back and say, they're trying to say that I'm crazy. No,
No,
Right.
you
they're
have
not.
anxiety.
They're just trying to tell you that it's not a physiological type disorder that's going on here, especially if you go to the emergency room more than once. But your palms may start to be sweaty. You may start to sweat like you're just, profusely, and just
Yeah.
you're trying to figure out, and your heart is racing, and it feels like your chest is tightening up.
A
And
lump
it
in
has
the
to be
throat.
a heart attack, but it doesn't necessarily. And it can show up at any point and any time.
Mm-hmm.
And so those are the two most common disorders that we actually deal with, are depression and anxiety. And of course, there are numerous ones because of the DSM-5, which is our Bible, TR. And it tells us what to look for when we're doing a diagnosis.
Right.
So therefore, you have to meet a certain amount of symptoms in order to be diagnosed with either one of those disorders, okay? So don't think that, and I hear people say all the time, oh, I have bipolar disorder, oh, I have this, I
Yeah.
have that,
Wow.
because
Yeah.
they've only heard two symptoms
Right.
and not heard the
Diagnosed.
six that we need to have in order to get that diagnosis. So sometimes if you look at them and you're on doing that WebMD, you'll walk away thinking that you have everything. And you'll start acting like you have everything because it looks
Start
like it
believing
fits
it,
me at
yeah.
the time.
You talk
So
yourself into it.
it's really important that you actually seek out help. And talking to someone is just as easy as what we're doing right now.
Right.
Absolutely.
Right.
Okay,
Absolutely.
we're just talking as if we,
Right.
we're old friends.
Yeah.
And we're talking about things, and we haven't told any really story. You were talking about storytelling, so
Yeah.
I like that, is when you're talking
Yeah.
about what to process and what to do.
Right.
But mental health is just something that's so valuable
Yeah.
that we really need to understand that if our mental health is not okay, our physical health is not going to be okay either,
It's a
because they're
spiral.
connected.
Right.
Absolutely.
The mind, body, and soul. My brain is telling me to move my hand right now,
Right.
and to be able to talk just like yours was,
Most
or what
certainly.
have you. So it's important that we
Right.
understand
Right.
Yeah.
what that actually looks like and what we need to do. So we're going to come back. Are we getting ready to break right now? Awesome. So we're going to come back and actually give you a checklist of things that you need to look for. And then we're going to move over to really talking about suicide before we end the
Okay.
segment for today. Is that okay?
Sounds good.
Okay, and I really
All
want
right.
you to talk about how to get to your services.
Boy.
Thank you.
Thank you.
Am I live? Okay. Are these professionals awesome or what? You know, I don't even know. I want to say first, I want to say thank you. And for those that are listening, we are K. Davis in the Community Foundation presenting this. We call it a showcast because you have an audience, but it's a podcast, and we know that it'll live forever. So I think, Dr. Bill, one of the things we want to make sure is that we captured everything you guys are saying so that we can make sure that this stuff stays available as we kind of take this journey. You know, we were commenting tonight. See, Janice, I think, Dr. Bill, I think you were on my very first podcast.
I was the very
She
first
was like
that you
the very
opened.
first. So she's been a friend for a very long time. Tells it like it is. And to be 1 year later, it's a year and I guess maybe a few shows into the next year, we're still here. And you and your message, I'd go to the beauty shop with her. I mean, she's literally has always been that sound, that whole the thing that you're doing, what have you, for me and others, just being who she is, right? And so I knew that in this time, Dr. Bill, that you would be able to come in and navigate this subject in a way that people need to hear it. We were commenting, do you realize this is the smallest audience we've ever had for this show? You had more people probably in the beginning. I don't know about that first show. But now normally those seats are filled and all that, but we're talking about politics and, you know what I'm saying, knock 'em, rock 'em, and let's do this and we better do that, and this one's running for office and all that kind of stuff everybody's all excited about. And so we noticed that when we said, okay, now we want to talk about self-care. You know, this is Suicide Awareness Month and things like that.
Right.
And it's been quiet.
Yeah.
And, you know, the ladies, you know, we were like, could it be the subject? And it came right back to the very first thing you said when you got there. It was, people don't like to talk about this. It's kind
No
of taboo.
elephant in
And so, I mean, we got some folk that's been here for the last, 3-4 months, and they're not here. And I'm like, this is a little unusual. But they have to know, honestly, we're going to be K. Davis in the community. We're going to be about the business, and this kind of stuff is important. And we will, and Dr. Bill, we talked about your series. We're coming back again, because whether you like it or not, we're going to tell you what we think can help and what you need to hear. So I just wanted to make sure that we wanted to thank you, say how much we thank you for it. I think one of the earlier guests that, Lauren, we reached out to was VA. And they were thinking about it, and I think they said maybe later, but we kind of Googled some stuff, and we had some questions for them. And I don't know if they were just ready or knew how we were going to approach it or what have you, but we heard about those numbers in the Army and in the armed forces, and about suicide and things like that. And I'm learning, just from listening at you, what have you, that we all have some growing up to do, and some self in the mirror looking kind of things that we all need to do. What I asked, before you go back into your next session, I asked Lauren, who is a caregiver, I said, when they come back and talk, can we ask them a specific question that that you wrestle with, and can you share what you think others may not ask? But they want the answers to. So as you incorporate, Janice, your agenda or what have you, if you can make sure that we can answer. I asked the 3 ladies that are here because all of them have families, they have children, and they're navigating, and they're them super women that you've been talking about all night. You know what I'm saying? Acting like it ain't nothing, including me. But we all know, however we figure out how to deal with it, we get it done. And I think my question is going to be about all this thing about the medicines that they're giving the kids. My son has teaches middle school science and history, and he talks about, he was telling me, he said, I got a call from the parent because the kid has this. He's supposed to be ADHD, whatever the buzzword is these days for him having. He's not someone that back in the day we would wonder special education and all of those labels they gave, because they didn't know what else to say. But now in the schools, he goes, oh no, Ma, everybody's in the classroom together, but he has some things that I'm supposed to make sure I do. Because I'm going to be the one getting in trouble if I don't make sure that I read it out loud, or if I don't do this, and he was like, they are so serious. And so when I got that email from his mom, because he got a D, you know what I'm saying, he didn't turn his work in, and she wanted me to give him another break and whatever, stuff like that. Then she started picking at, well, did you do this? Did you do that? On the list. And I said, you're kidding me. He goes, no, I'm very serious. And I said, do you think there's really an issue? He said, no. There's an issue, but it's not, no more than a stern, what back in the day would have done. Now the parents are protective of, and I'm interested. I know that's how things are going, but I'm interested in your opinion about what we've done now with adding those kind of things into the school, so the teacher is almost on defense and worried about his own or her own job if they don't go through these rules with respect to managing, children. And they put them in the room together now, which I think is great, because they don't want to separate kids and things like that if there's not something that really, like assistance with the restroom and things like that. But it blew my mind, that he was concerned that he would get in trouble if he didn't check the boxes. And he said the boy was being lazy and you know what I'm saying, it's like didn't do his homework. And I'm like, instead of you as a parent trying to make sure he does his work, you're trying to make sure that he gets that A or B or whatever that you wanted him to get, whether he did the work or not. So that's a new thing for me. So I would like if you could address a little bit of that. So Lauren, would you come with your question? Do you have a mic?
I did. I guess you can hear me. Hello. My name is Lauren Marshall. I am a caregiver for the second time. My mom passed away almost 2 years ago of Alzheimer's. And then after she passed, my dad was independent at the time. He did a 360. So he started needing care. So I had to get him somebody to care for him while I was at work. So for me, it's hard to say no and set boundaries and take care of myself. Because I'm like you say, I got the cape. I have the cape on. I think I have to be Superwoman, trying to be there for everybody else. And I always put myself to the back. So I guess my question is, how do I really set those boundaries, say no, and put myself first, while still saying, okay, I have to take care of my dad, make sure he's okay. Because he's at the forefront of my mind. And he's 93, still going strong,
How old is he?
grumpy. You know? So it's hard. It's hard. It's very difficult at times for me to just be me, because I've lost myself. And it's like, how do I get Lauren back? And, you know, and still do what I need to do.
That's Lauren's question. And I asked them to have questions that they know is across the board. I'm going to mention Linda Ragland. She's not here tonight, but she told me, Danette, caregivers. It's a thing. I said, okay, I hear you. Chelsea? Question?
Hello, my name is Chelsea Jenkins. I've very much appreciated this conversation. So many things. I'll just say that as a mother of a 21-year-old son, in this type of environment, black boy being, I've pushed him to think he can be amazing and do all these great, amazing things. And then, you know, we have, can I say orange man? Can I say orange man on here?
Just say Pennsylvania resident.
Oh.
Pennsylvania resident is a good one.
Yeah. So, and then we have, you know, telling him that things that are important to him shouldn't be important, and that his existence, his very fabric of everything that he's made of can be questioned. And you're saying that, like, black men are leading with suicides. Like, I think we need to start talking to where are the black men at this table? We need to start, like, I don't know. I just feel like there's a bridge and there needs to be a connection, and I'm not sure exactly how, but if we can just start thinking of ways to incorporate them into that conversation, because I didn't realize that they were the leading. Okay. Yeah, thank you.
And one more. You had one? Oh, you I'm doing it now so that you are not interrupted at the end and have to answer one at a time.
No, I think
if
it's
you
good.
take the notes and you guys can just flow and we'll just listen.
Hi, I'm Agnes Aggie B. And actually, this is very enlightening for me. You spoke on depression and you spoke on grief. I deal with both. So I can definitely walk that walk right now and talk that talk. I've lost son, mother, sisters, and like close together all at the same time. And my father, all of that. So how can you tell a person to continue to function when they're carrying all that along with other PTSDs? You know what I'm saying? So it's a lot to deal with at the same time, and yet you're trying to motivate yourself at the same time, and you hear other people trying to motivate you at the same time, but yet you also have that little thing still saying, but they're not here anymore. So again, I, as far as me, I didn't realize I had an issue with death until I lost my son. So then a sister right behind it, another sister right behind that, all within 2 years. That's half sister, step sister, all in 2 years. So that's a lot at the same time. So how do you tell a person to just move on and get over it? Because people do that. They'll tell you, just get over it. They're gone, you know. But that's not something you tell someone. You don't know what effect it has on that person or how they're walking with it or carrying it. So my question is, how or what do I need to do, or what should anyone do to keep going regardless of all of that? The trauma of loss and other traumas and everything else, but you're trying to keep going regardless.
Before you come up, I think when she was kind of sharing, I told her, you know, in a lot of industries, I remember when I was trying to take trigonometry, and there are not tricks to the trade, but shortcuts or and things you memorize that they would when they were trying to teach, because I was terrible in trigonometry, so I said, okay, but just remember this and this rhymes with that. No, you know what I'm saying? It's so when I was telling Agnes, I said, I think what we're asking is there a place to go to? Like me, I'm you know, I'm big on the Bible and stuff, and I know all the, you know, but you know, I say them to myself. You know, and honestly, I'll start saying things to myself out loud, and after a while, you say it, you know, Jesus, Jesus, Jesus. You know, 10, 15, but your mind will go somewhere else. I mean, it takes me, works for me, but I don't know how to help other people. So I think they were, not that they're looking for tricks or something, but a way maybe that's not always the answer. Probably need to maybe people get counseling and things like that, I understand. But there's some things that you guys have found that's helpful on a regular, on that kind of thing. And this is the last question, and then we'll go to your second half.
Hello. My name's Dorian Gray. Give me a second to finish your notes there. Okay. All right, so my name's Dorian. Got a lot of things on my heart after what I heard tonight, especially that stat of 15 to 24 being the number 2. Did I hear that right?
Mm-hmm. That is correct.
Wow, that's staggering. Let me just introduce myself outside of the musician here. I spend a lot of time in the Bible, I pray a lot, and I rely on God, okay? And I don't know where it came from, but somewhere a couple of years ago, a few years ago, I started praying about this. I was like, you know what, there are people that need some help. And I see how God has like restored my heart to the point where people are, wow, are you ever unhappy? I'm like, you should have known me before. But he's helped me, right? My question is this, because I didn't know you guys were going to be here tonight, and I specifically had been praying over the last year or so. There's some people out there that in these little nooks of these neighborhoods can't get to. Nobody knows about them, but they're thinking these things, and they want to do them.
Right.
And after a few minutes, I started seeing them. I ran into a lady on the bus stop. Decided I was going to share my faith with her about God, and she said, "So what if my friend wants to commit suicide? What?" And I'm like, "Whoa!" So now
That's okay.
And not only that, I started a prayer thing a few weeks ago, 2 Mondays ago. In that prayer, someone comes out and is talking about somebody, you know, trying to do the same thing. Only 2 weeks ago, and wow, it's like it's I don't know. So here's my question. I get out there and I talk to people a lot. When I run into a situation like that, I am not a trained licensed. I think I heard licensed up there. I'm just a person that somewhere learned some compassion and learned, hey, you get up and do something about it.
Right.
So those are my 2 questions. When I'm at a bus stop, what might I be able to share that might have some impact? Not just this, you know, God will take care of it. Some real help, because these people really need it. Like the one I heard from a couple of weeks ago, the friends don't understand. They're telling me about it, and I'm like, wow, you need to get over there. You need to do something now, don't wait. What can I share? If you can come up with anything tonight? I know it's just not.
Oh, without a doubt.
So that's the first question. Because that's starting to happen for me more and more. I think God is answering that prayer. He saves my heart. I want to help. Secondly, on a professional level, I've worked with health department here in Houston. Over in California, I used to have 3 different cities that I was responsible for. So, you know, it was health, it was, you know, disease kind of thing. So if I may be able to help in your situation or any situation where there's some volunteering, maybe there's a position or something. But I noticed that I do have a passion for that kind of thing, and I want to help. So I probably need to be trained and in the right area. So the quick fixes at the bus stops right now, if you have anything you can give to me, and then also something that might be ongoing for people over time. I'd really love to help.
And with that, ladies, I think we were going to do just one little piece. Avery, you got it ready to go? And then we'll let them crank up, and Dr. Bill, any way y'all want to do it. And then you just let us know. I mean, just wave at me. And because this is to me, I don't know which one is on, but really important. And if we can grab and glean from y'all tonight, we're going to hang this piece out, and we're going to invite others to watch it. You know, we're going to do parts and pieces of it and make some short things that we think people can use And I just want you to know that. So I hope you guys will be good with it, because we think whether you want to hear it or not, we're going to make it so it make it available to you. Okay? Thank you.
Join us this Tuesday at 7 p.m. for Trending Tuesdays, episode 29. This week, we shine a light on Suicide Awareness Month with theme Self-Care is Shared Care. Our special host is behavioral expert and practicing clinician, Dr. Janice Bill, who will lead the conversation. Joined by Ms. Ronetta Owsley, licensed grief coach, and Ms. DeMonica Neal, licensed therapist. Together, they'll explore the power of self-care, shared healing, the reminder that you are created with purpose, love beyond measure, you matter, stay. Streaming live from the K-Data Showroom plus Mostly Greens with Chef Eddie's delectable vibes. You can also catch us live on YouTube at 7 p.m. Don't miss it. This show is brought to you by Danette Davis and Kay Davis in the Community, because this conversation matters.
Go to the school question for you. 2. Welcome back to Trending Tuesday. I'm Dr. Janice Beal, here with my guests this afternoon. I am the MC for the evening, and I am thrilled to be here because of the fact that we are talking about something that's very passionate to me, and that's mental health. Yes. And I really want, before we get started with answering some of the questions that were presented to us by the audience, is to understand that mental health is not a destination, it's a journey.
Absolutely.
And it's a part of what we go through on a day-to-day basis, making sure that we are able to take care of our mental health.
Yes.
So it's not like something that's going to be complete and we're never going to address it again. We may get through something and may not need therapy any longer, or may not need coaching, but we can always come back and revisit it.
Right.
So what an amazing thing to be able to have something, to take it to a room, talk to somebody about it, walk out of that room and feel a whole lot better. I think that that's important. So getting our community to know that we're not really getting into their business,
Right.
that's not what we're here for.
Right.
It's a matter of being able to help with some of the disorders and things that they are suffering from, that we've been trained to do,
Right.
and to understand what that actually means as a clinician, a provider of information about mental health, provider of coaching and mental health, go side by side.
Absolutely.
For what people are doing. A lot of therapists are now becoming coaches,
Yes.
as opposed to actually not treating one-on-one counseling type
Right.
of things. So do understand how important mental health is and how it intertwines with everything in our life.
Right.
Absolutely.
So no matter what age group a person is in, they may have something that they are suffering from and don't know how to seek help. One other statistics, and I believe in always sharing statistics, is the fact that as a group and a culture, we utilize the emergency rooms more so than we do coming to a doctor's office and talking about things.
Yes.
And that's because when we're in the middle of a crisis, we decide that we just don't want, we don't know what doctor to go to, we don't know what to do, so we drive our loved ones to the emergency room.
Right.
And so therefore, we're not really getting the help that we need at that particular time. They'll make the referral and tell you whether or not you meet the criteria for whatever else is going on in your life. But we need to understand that preventive is more important than proactive.
Absolutely.
Proactive, and preventive type of methods are more important than reactive type of methods. Excuse me for making that mistake. So we need to understand, if we're trying to get ahead of things, because African Americans, we're at the top of everything. The worst with heart disease, the worst with cholesterol, the worst with any type of disorder, any type of things that people can even think of with our body. And the same thing is for our mental health. So we need to be proactive and talk about those things. So I think that we're going to probably, some of the questions I think that were presented, I think are very important. For example, if you can talk about what happens in the schools when a parent gets a call about their child? What do they talk about when they come? Because the teacher may be inferring that there's something that's wrong with that student, just based on the limited information that the teacher has, because teachers aren't clinicians and they're not therapists. They're there to teach, but they may see something that they think mimics something else. So how do you think parents should address, because a teacher may say, well, I have somebody in my family's ADHD and your child acts just like my child. Okay, so which means they're diagnosing without even knowing what the real symptoms are. And I think that we can probably not go in and teach the third, fourth, or fifth grade as well as they could, or sixth, seventh, eighth, ninth, whatever grade we're talking about, but to be able to talk to parents, to let them know if in fact there is a concern or a problem. Okay.
Well, first, too, just addressing the accommodations in the classroom and things like that. I do believe that accommodations are necessary for kids experiencing ADHD and various diagnoses to help them succeed in the classroom. However, what tends to happen is parents, I guess, stand behind that diagnosis and keep that. It prevents them from parenting, if that makes sense. So that's why when she was talking about, well, did you do this and did you do that, and putting the blame on someone else and not taking accountability for the lack of parenting that comes from the home, because the child is at home more than they're at school. And so even though things kind of happen at the school, it needs to coexist with things happening at home and at school. However, get into that question too. So when I worked in the school, I was a social worker on the campus at one point, but then I was also the crisis counselor for a district, and I serviced 3 different schools, and so they were K through 12, and because of that, the school was able to say that they offer mental health in the school. But I'm one person for 3 different schools, right? And so I will always encourage a parent that if you do feel like your child is suffering in any capacity, yes, the school counselor is a good starting point for a referral. And yes, having that crisis counselor, mental health professional on campus is great for crisis situations. But when it comes to ongoing therapy and addressing the root of an issue and helping that child succeed in and out of the classroom, I do recommend getting one-on-one individual therapy outside of the school. So that they can get that individualized attention that they really do need. And the mental health professional on campus can't really provide, because they don't have an office or they don't have the tools that they need in order to successfully conduct the session. And so I just want to put that out there too.
Okay. Well, I'm sorry, you're about to say something?
Well, just to ad lib, many parents don't realize their insurance company pays for that. Okay, and that's an important avenue that Medicaid, Medicare, those providers, you merely have to call them and ask, because it all is inclusive, especially for the children, because they're on Star Plus. I worked with IDD with the Harris Center, and I had various age groups, you know, the adolescents, the older kids, and all of this. But for the children that's on those waiver programs, it is so accessible. You just have to call Medicaid and ask them, and they can give you a referral, or you find one that accepts the services. And even in the grief coaching that I do, I accept Medicaid, Medicare, Aetna, Blue Cross Blue Shield, United Health, and so they allow so many hours for the sessions, in order to help. So, but
And also, because of COVID and things
Yes,
that happen, now we have virtual sessions.
absolutely,
And
absolutely.
so a lot
That's
of
key.
time, accessibility is an issue, but we have
Right.
virtual sessions now.
Right.
And if that is included in their plan, they are
Yeah.
able to step out of the room and conduct a set or have a session with their
Right.
therapist in the school.
Yeah.
So that's an option too. And also
Right.
there are free options such as the
Right.
Pelchin Children's Center
There you
that
go.
offers free therapy for children 3 through 18 and their
Absolutely.
families. So there are things out there we just don't know about.
Absolutely. And then in your churches also, because our church, Lily Grove, we have free service with grief, and we have the Zoom meeting and we have in person, and you do not have to be a member. You can just call and you can go on our website, Lily Grove Missionary Baptist Church.
Awesome. Thank you for sharing that information. Having been a board member for all the organizations that you're talking about, from DePelchin to the Harris Center to Harris County CPS to the National Mental Health Association, I've always advocated for minorities, and I've always advocated for people that look like me.
Absolutely.
So therefore, understanding what mental health is about as a community becomes very, very important. And I don't think I can hit home hard enough for parents to understand that if your child has some type of behavioral issues or mental health concerns, it's no reflection on you.
Right.
Absolutely.
It may mean that we may need to change things, because I've actually opened 3 inpatient psychiatric hospitals for children units. And throughout that time period, for the years that I spent doing that, we would help children to be able, they may have been suicidal or they may have been homicidal, that they actually came to the hospital, because those are the criteria in order for hospitalization to take place, other than medication management. We put them back into the homes, and within a short time period, if therapy isn't continuation of therapy, the behavior that we were trying to help goes back.
Exactly.
Okay. So therefore, it requires that the family becomes involved.
Right.
And so the parent that's going to be, I want to say that please be open to what you're hearing. And some of the things, I never would say not my child, because I wouldn't know what my child was going to do when they weren't in front of us. Okay. So that's the first thing that I would hear people say, oh, not my child. And I was like, really? I say, I won't even say that, because I don't know what she's going to do
Right.
when she's not
Absolutely.
with us. So let me hear what you have to say, and go with the intention of saying, what can I do for you to help you help my child?
Right.
So now we're going to come in together. So those are word choices we're using going into the schools. And I may not agree with you, but let me go ahead and get an evaluation. Okay, we can't give a child a diagnosis within the school without going through the whole process of
Right.
what it takes to
Absolutely.
take place.
Yes.
And having worked, I think that I probably have had a contract with maybe every agency in Houston, I think, at some point. But having gone from the preschools to understand what behaviors that if we could stop early, which may have been parenting issues, because here's the one thing I want everybody to understand. I will parent the way I was parented unless I seek out additional information. And so people don't realize when we take that little pretty bundle of joy home, we're going to treat them and do and teach them based on what we went through. Unless we said, oh, I need to learn different information. I need to learn different things about parenting, because it's difficult.
Yes, it
It's difficult to have a baby and then raise them and send them to school, and you have more than one. So
Absolutely.
if there's something that you didn't like about the way you were raised, and we're talking about traumas now,
Yes.
then it's important that you understand that you can seek information, so you can have parenting classes that you can actually seek out without being made to take parenting
Right.
classes,
Absolutely.
like the Pelchin office parenting classes
Yes.
in all the different locations. And then you can go actually to your therapist and talk. And we can talk. You can talk about parenting techniques and what to do and what not to do, so that you understand when to actually respond on that issue and what that looks like. So it's about developing a relationship with the school, going to the school and actually listening, and then determining what your child needs. If you have more than one child, every child is not going to need the same thing.
Right.
Okay, so what we look at before we give a diagnosis is we look at the behaviors that we hear. I used to call the schools or call the teachers, and I would make sure that we're all on the same page.
Right.
God, there was even a time I even used to go to the schools and sit in the IEP programs to make sure that we were actually providing the correct service that was needed. So it's a process. And thank you for sharing the things that you talked about in school, and thank you for sharing the fact that, you know, it takes everybody, and the fact that these things are paid for.
Yes.
Okay.
Yes.
And I really appreciate the fact that you mentioned all of the Medicaid services that are paid for, and United Healthcare, and all of the other agencies, and Blue Cross Blue Shield. If you turn your card around, on the back of your insurance card, whatever insurance that you have, you'll see behavioral health coverage.
Yes.
We no longer say mental health a lot of times, and substance abuse.
Right.
We do behavioral
And
health
support.
coverage because that covers what we're talking about.
Everything.
It covers everything. So, and there's a number that you can call, and they can refer you to, or you can call a doctor's office or the social worker's office and ask, do you accept Medicaid? If that's the insurance, or do you accept Medicare? Let's go to the other end, because we're on one end, we're talking about the smaller, but we got to grow up and get to the other end, Medicare. And what does that look like?
Absolutely.
And how much of copay? And so all those things are important when you're knowing. Don't utilize when it's in a crisis. You know if your children, or if you're actually feeling like you're on the edge of what you need to do to go and stop and see somebody. And guess what? It's okay.
It's okay.
It really is okay. And I think you mentioned psychotropic medication earlier, and we didn't touch base on that. And we're also not wanting to actually get medication for some disorders. Now, we're talking about talk therapy, and we're talking about talking people through different issues and how we're going to help you. But sometimes talking just won't work.
Right.
Absolutely.
Okay, I know when I've gotten to a point where I can no longer just talk about it and I say I need help. And that means I need to refer you to a psychiatrist or a
Absolutely.
nurse practitioner.
Right.
Because
Yes.
now we have nurse
Identifying
practitioners who are trained in mental health that can also give medication as opposed to psychiatrists that look like me. The numbers are limited. We're in
Yeah,
a city
they
with
are.
4 million people. The waiting list can be anywhere from 1 month to 2 months. So there are other people who are able to make sure they have the training to be able to go and actually help with the medication. And you can maybe get an appointment sooner, but don't etch that out
Right.
as something. Because I've seen people who are coming off of drugs say, I don't want to take any of that medication because it makes me addictive. Well, wait a second now, let me think. You are smoking marijuana every day. You're drinking a lot, but yet you don't want to take something that we know that is not addictive to help you to be able to process what's going
To
on.
normalize things.
And if you stop before you actually start to feel better, that means that you've stopped treatment.
Right.
Absolutely.
Okay, and don't go to the psychiatrist and only get medication and not go into therapy.
Right.
They go
Absolutely.
hand in hand.
Hand in hand.
And we need to understand that. It's not just a fix. We're going to stop him from jumping around in the classroom. We're going to stop him from jumping, but we're also going to give him techniques to be able to function. And we're going to help the family
Yes.
members to be able to
Yes.
function in the house.
Right.
So
Yes.
everybody heals throughout the process. So it's not just a fix, one-time fix, and therefore it's okay. It means that we work at it. Just like it took time for it to get to where it is, it takes time for that to change, to happen as well. Okay, so I hate to tell everybody, but I can go on because I've lived this and I love trying to help people become better. Yes, ma'am.
Dr. Dennis, I have a question for you. In regard to, and we're looking at all these fruits here. The diet. Do not the diet have to do with sometimes their behavior with IDD, with,
Okay, it depends on what era we're talking about. You know, the research has gone back and forth.
Right,
Because
okay.
we used to be the dyes that were in, and I'm assuming
Okay,
you're talking about
yeah.
attention deficit
Yes,
disorder
yes,
mostly.
yes, yes.
Okay, the diets that we used to have in the red diets, and they used to correlate that with the chocolates and things that you would give children and send them to school, and all of a sudden they'd be bouncing off the wall.
Right.
There was research that said this was responsible for it, and there was research that came back and said it wasn't.
Right.
So a diet is good regardless of if you don't have any concerns,
Right, yeah.
understanding how to eat healthy and what that looks like and the impact that it has as far as us having the energy that we need to have.
Right.
So I would not recommend giving your child a lot of Hershey's chocolate
Sugars, yeah.
and sending them to school as a part of their lunch. That's not healthy any way you look at
Look
it.
at it.
You know, Although I
happy.
loved hot tamales and I love Dr. Peppers, but can you imagine the amount of caffeine and things that are in certain drinks? And so we
Yeah.
need to start looking at
the
our diets
sugars.
as people and the amount of sugar
Right.
and how bread breaks down the sugar and
Oh,
the
yeah.
impact of being tired. So yes,
Yes.
food intake definitely has an impact. Does it
Right.
cause a mental health disorder? I'm going to put all of my years of being out there and say it doesn't cause. Can
Right.
it contribute to it? Yes.
Okay.
Okay, but I don't, I mean, so I was a part of the changing of the terms.
Okay.
Minimum brain dysfunction is where it started off, is when we're talking about ADHD now.
Right.
Then it went to ADHD with hyperactivity, ADHD without hyperactivity,
Right.
ADHD with hyperactivity and inattention disorders. So it's gone through the many name changes to get to
Right.
where we are today.
Gotcha.
So, but yes, I
Thank
think
you.
everything could, but I also think I can teach a child how to organize
Mm-hmm.
and put their socks together by putting a safety pin so that helps them with their organization skills. It's something that can be taught.
Right.
Everybody's learning at the same time.
Absolutely.
So the medication helps them calm down for the time period that they're taking it,
Mm-hmm.
but I swear they'll be your little darlings right after you finish. So within that time period it comes in your system and goes out of your system, they go right back to where we are. And that's about psychotropic medications for anyone. So that's why it's important to take them as prescribed,
Absolutely.
as opposed to taking them when you feel like
Hitting and missing.
you're depressed, so you're going to take
Yeah.
a pill today.
Right.
And if you don't feel depressed tomorrow, you're not going to take one. It's a chemical imbalance. That's all it is. And a chemical imbalance in the brain means that we take something to balance that lacking of that neurotransmitter that takes place. So y'all are taking me all the way back to my teaching days now, of being able to tell you what it looks like and
Right.
why it's important and what happens to our
Right.
neurons and how all of those things connect and to be able to make everything okay
Balance out.
and balance out. So I would say get a second opinion if you don't believe the first person that you go to, but at least explore if someone is recommending that talk therapy does not do. I'd love to say that we were great,
Yeah.
but to be honest with you, we're only as great as we can because some
Right.
things require extra help.
Absolutely.
Okay.
Absolutely.
So we're going to go to the caregiver question, okay?
Okay.
Caregivers. I think the question in reference was, how does someone who is a current caregiver and has been a caregiver in the past, how do they manage now and still find who they were? So let's say we have two parents, and the first parent you took care of, and that parent is no longer here.
Right,
So
right.
then you're taking care of the second parent,
Right.
and you feel as though that you're doing a lot.
Right.
Been talking about this for a minute because I guess as I age, my age group, I keep going up the ladder. So now I'm into this ladder. I'm not gonna tell you what decade it is, but the
Right.
decades keep going up.
Right.
And you know, I was speaking about this at the Congressional Black Caucus last year. And it was sponsored by AARP, and I was like, "Ooh, what does that mean?" I hate when that AARP card came in the mail.
Yeah, I don't care
It
about
was
that
like
commercial.
they made you take it no matter what. They just wouldn't stop sending that card. I mean, it was kind of.
right.
But and I came up with this idea. I stopped to take care of me, and I had the T-shirts made right before I got on the plane to leave the very day before, and I used it on stage. And I said, in order for us to be able to take care of ourselves, we have to stop for a second.
Correct.
And you have to process what are you doing and what's tiring you out and what does that actually mean? What can I
Right.
do to take care of take care of me? Does that mean I do meditation early in the morning before I start my day? Does that mean that I change my diet? Does that mean that I walk around the block? What do you enjoy doing that you stopped doing because you became a caregiver? And the number one thing that most people, and we've kind of come down to, is they don't ask for help.
That's dangerous.
If you don't ask for help, you will not get it.
You
I
will
guarantee
not.
you, because nobody's going to know that you need it.
Absolutely.
And so therefore you will wear yourself out. And that's why sometimes a caregiver is the person that actually leaves first
Absolutely.
before the person they're taking care of.
Yes.
So it's important that you put things in it. You come up with your own schedule, just like you schedule the doctor's appointments that you have to take
Yes.
someone to.
The me
Schedule your
day.
rest appointments as well.
That's right. Yeah.
Schedule the time that you're asking for someone to come in, and you do nothing during that time period
Absolutely.
but rest. It's almost like when you have a newborn baby, and moms used to jump up in the middle of the night, in the middle of the day, and do everything and wash the clothes and do everything while the baby was sleeping. Then by the time the baby woke up, you were exhausted.
Yeah, truly.
Because you didn't take any time out
For you.
for yourself.
Exactly.
So
exactly.
schedule that time. Make it purposeful that you're
Yes.
doing that. Praying, meditation, all the things
Yes.
that we have depended on as a race of people,
Yes.
is important.
It's
You know,
vital.
you can't. I don't believe you can do anything without God. First of all.
Absolutely, number one.
So
Yeah.
that's the most important thing, is to have a relationship with whatever or whoever, because I don't want
Yes.
anybody to have the same beliefs that I have. To
Right.
make sure that you have a relationship with a higher being.
Yes.
So when you start your day, that you're spending time putting
Quality
something into
time.
yourself.
Yes.
And actually going to sleep. Sleep deprivation can also cause mental health concerns. I don't know
Oh,
if you know
yes,
about that
for
or
sure.
not. And not getting enough rest. If you don't get enough rest, it'll flip on you, because we need how much time to sleep? How much time do you have?
8 hours.
Oh, you do 8 hours?
I do 8 hours.
Awesome.
Yeah.
Look at that.
I have to.
Okay.
I love me, remember.
Amazing. Yes. And it's okay to say I love me.
Yeah, you
It is
have
not
to.
selfish, and
Yeah,
it does
no.
not mean that you weren't raised right. It means that you understood the most important person, and the most important
That's
person is
right.
you.
Took me a while to get there.
How many hours do you get?
I'm a little bit different because I do have a little one at home. So my sleep is broken. So I would say I average like maybe five to six.
Oh, poor you.
But I'm gonna get back to
But you're
I'm gonna
young.
get back to it.
But you're
Not as young as I used to be though. It's getting different this time around.
Oh my God.
Okay.
5.
Sleep is so important, and we teach.
It is.
We're teaching high school students. We're teaching college students, because people tend to want to study
Yeah.
and not go to sleep. It's okay if you do it for, but prolonged and chronic stress
Yes.
that's created by that is not good.
But also what happens too is when you are pouring into everybody all day,
Oh,
you
yeah.
take that time at night for your me time. And then you're watching your shows, or you're eating something good, or you're doing something to pour into yourself
Right.
that then starts to flow into the time, and then you don't get to
Exactly.
sleep.
Well, here's another thing
right.
I think in order for anyone to take care of themselves is to get rid of this at night.
Oh, yeah.
Okay. It's important not to have this close to you in bed at night, because the light that
Smart.
comes from your cell phone will keep your brain moving and the activity constantly going.
Yeah.
So take your cell phone, unless you're caring for someone and you really think that you need to be available. Don't read. Don't do Facebook, TikTok,
None of
Reels, all the things that keep people up in the middle of the night. Just put it down and just relax. Play some
Yeah.
music.
Yeah.
There's a app that I use all the time called Waves that I recommend.
I was just telling her about
And it's free.
that. Yeah.
Waves.
Yeah. Waves.
And it's free for Androids as well as
Yeah.
iPhone users.
It's amazing.
You download it and you just let it play, and just learn how to go to sleep. Learn how to remove all of the things that are in the room that keeps people awake. Some people have to sleep with the lights on. I get it, but doesn't have to have the television on. If do a night light, allow the brain to relax, so that mentally we're giving it. It's the same. It's an organ that requires some attention. So let's take it down, especially if your brain is constantly moving. Now mine
Absolutely.
moves a lot too, though. But sometimes I wonder, how do I get stuff accomplished? And I don't know. I just seem to do it. But I tell you now, I get sleep. And that's because I don't want these bags under my eyes. So that's another thing too. So, and people are laughing, but that's important. Laughter to
is.
me is
It
important
is.
as well.
It is. It's healthy.
Okay, it's healthy. The endorphins that are released when you laugh are the same endorphins that people use when they do drugs and do illegal things.
Wow.
So it allows you to be able to smile and laugh and
Yeah.
release and feel a lot better after that takes place. So that's another one of the, watch a funny movie. Don't watch a
Yeah.
drama movie.
Oh.
Don't watch where people are scaring you
Oh,
and you're,
no way.
you're,
Yeah.
you're
I
whatever.
want something
And why would you watch a movie about babies when you're taking care of one? You want to watch something that makes you relax and makes you laugh.
Yeah.
You know,
yeah,
so
yeah.
do something that's for you, part of me
Yes,
time,
yes.
to be able to take care. I think I
Absolutely.
wanted to make sure that you get to the question on grief and that was presented to us.
Yes, Lauren, and then the young lady who had the multiple
Deaths.
deaths. Taking care of yourself. In the you shared a lot about the self-care and the boundaries. It's vital about the boundaries, and having an extra person, another caregiver, like two caregivers of trustworthiness, so that if something happens where that person can't take over, and plan little short vacations, outings to go to nice restaurants or whatever that you used to like to do, like the art museum, or take a little narrow trip or something. It's vital to get the you. It is, so that when you come back, you're not stressed and feel overwhelmed in taking care of your loved one. And as for the multiple deaths of the other young lady, each person, each experience, because of your attachment, is totally different. And with the multiple deaths, identifying those relationships. Just in short, my mom and my baby girl, their passing were less than 7 months apart. And losing a child is totally indifferent to a parent. And then it depends on how close. What was your attachment, your relationship with that person? And when my mom died, it was like, I was totally crushed, because we shared so much together. And her opinion and how she carried herself. I mean, she was such a lady and professional. And late in her end days, she died of Alzheimer's and complications. But she was an educator, and I watched her being a strong, black, dependent woman, and she became my child, depending on me. And then my baby girl, when she passed, it was like life just came out of me. And that's a total different love, relationship, and handling. And you could have a cousin that's closer to you than one of your brothers or your sisters, because of how you connect. That relationship is about the relationships. And it's vital to identify those people in those relationships, and how you treat that. And there's no timeline of how long you grieve. Grief come in all different ways. There is no specific way to grieve. Maybe listening to their favorite song, or you now want to wear their favorite cologne, or their dish, to celebrate, and what the enemy wants you to do is to focus on the enactment of the death, okay? But what's important is to focus on the experience of the relationship, the good, because God so loved you so much that he gave you that person to share in that love at those years outside of that one, to be, and the word talks about being absent in the present, in the body, yes, and present with the Lord. Yeah. So, don't allow anyone to tell you how to grieve, how long to grieve, and none of that. Every grief is different, as well as your relationship of taking care of being a caregiver. Caregiver, if you don't take care, it may sound selfish, but it is not. Because if you don't love yourself, how can you truly love and care for somebody else? You have to get that zeal back of life and moving forward. And you have to relay that even though they're going through their journey of demise, they may be in hospice. But if you bring them certain songs that they might like, or their favorite foods that they're able to eat, or, and talk about the good old days or whatever it was that made them happy, focus on those things. It's the good that you want to bring. Okay?
Excellent, excellent. Thank you for sharing that as well. There's such a thing called prolonged grief. That's a new diagnosis that started in probably 2020 with the DSM-5-TR. And it's not based in what we see as far as people being depressed. It's based in more so of people experiencing trauma. And so that's not wanting to actually let go to a certain degree of that relationship. And when it's prolonged to the fact that the person is not functioning, and of course they have to meet a certain number of symptoms in order to be able to be diagnosed with that. But we do recognize that as something that, and I guess it's been so long that people would say, oh, you're not over it yet. And to think that you're supposed to be over it 1 year, 2 years, that's an individual thing.
It is.
And so I think with your coaching, that will help them to be able to understand that where you are may be where you are right now, but next year you may be just a little bit further.
Absolutely.
And you may be just going back, and we talk about the 5 stages of death and dying and grief.
Yes.
And one of the actual stages, for those who are familiar with the stages of denial, anger,
Yes.
depression, and finally, it's one that I'm missing. That's only 4, and acceptance. They added to be able to value that person's life.
Absolutely.
So it originally came out with someone else who he worked with Elizabeth Kubler-Ross. But when I was preparing to do a grief conference for a family, which was the first time I'd ever done that, it was honoring that person's life
Yes.
that gave him strength. So he had
Absolutely.
lost his son. And so because he had lost his son, he had to do something to honor that. So it helped him to get through the 5 stages and to actually add a 6th stage. So his book I found very interesting because at the end of that particular retreat that we did for this family, we planted a tree.
Awesome.
So every time that they would go to that particular space,
Right.
that tree would be a symbolization of
Life.
who their son was, who
Right.
actually died by suicide. So it was he was 14 years old. So it was a pretty drastic type of thing that the family had to go through together because everybody started blaming each other, and it always affects the relationship. And before we leave today, I do want to make sure that we understand, I use the term died by suicide because we no longer say committed suicide. Because committed means that that's a crime
Exactly.
that was done. And dying is not a crime.
correct.
Okay, so if a person dies by suicide, which is the term that's the general term that's given now, it means that this is how that person died.
Very good.
So it means that, and I hear people say it all the time, I got to correct the term because it's time to change it, because this is what we're saying today. So there could be many things. We started off talking about so many different things today, but I think it's important that we leave here today with resources, because I always believe when you talk about an issue that people need to understand where can they go.
Right.
So I'm going to let each one of you tell your address, phone number, or whatever you want to share with the audience today about your business and what you actually do. And then I'm going to give you general information that's free services that you can actually reach out to. Okay? All right. Go ahead, please.
Well, again, my name is DeMonica Neal. I am a therapist and owner of Byway Counseling and Wellness Center. You can find us online. You can Google my name and I'll pop up. But you can also find me online at bcawc.com. And then everything will pop up there. You can reach out to me, anything like that. You can find me on Instagram at Byway Counseling and Wellness. I'm not on TikTok or anything like that, but you can always reach out to me in that way. And if you even need resources or anything like that, I can help point you in the direction if I can't be the one to help you.
Perfect. Excellent. Thank you. This was great in sharing. I am Ronetta Osley, proud owner of the Gathering of Truth Grief Coaching, Inc. And you can reach me, and my email address is my first name, Ronetta, RONNETTA, WANDA 333 @gmail.com. And my webpage, you can just click the bottom of my, I have, what is that? My card that that you can just click my address and it'll pull my site up of all the different services, group and individual services. Okay.
Okay, and as we end today, my name is Dr. Janice Beal. I am a clinician, I'm an author, a speaker, but most of all, I am a mental health professional. And therefore, I do want to leave you, and I have a private practice. Oh my God, as y'all were thinking, I was like, okay, am I going to forget this? But the address is 5959 West Loop South, which is not far. And then I also have an office in Richmond. Our phone number is 832-740-4642. But I think it's important that if you are asked, anything that you can take away from today, from our conversation, would be if someone were to approach you and they had a question about how do I help somebody, 988, not 911, but 988 is a suicide hotline. Okay. So I had an opportunity of actually working on that as they were developing it, that year-long or 2-year-long, as we got to the point of actually having the line to go live. And so one thing that I was consistent and persistent about every time we had a call, because I was volunteering my time, was the fact that we had someone that was going to answer the phone that
Excellent.
sounded like me.
Wow.
Okay. So we would know that we would have somebody that the person would call and be able to relate to.
Great.
And so that was important. So they did all languages. They put out a lot of information. When we go on college campuses, we just want to make sure that everybody knows. And it's easy to remember that 988 is out there.
That's amazing.
Another reference for someone who's trying to find someone is a crisis hotline, text line. Because you know this generation, they're texting now. So if they want to know something, they text, and they text 741-741, and you text HOME, HOME.
Oh, nice.
So that's really easy to remember. 741-741, HOME. We have what they call a black line. That number is 1-800-604-5841. That's for the LGBTQ plus community, to have someone they can relate to and talk to and actually share some of the issues that they may be having. You can find a therapist, Association of Black Psychologists, Association of Black Social Workers, the Association of Licensed Professional Counselors. All of the organizations, am I forgetting anybody? The Association of Black Counselors as well. They have professional counselors and they have counselors. The Minority Women's Organization. So you can Google all of these organizations and find. And I work for another I consult with an organization called the Steve Fund. If you have a student in college at a PWI or at another institution, it's important that you know where to go to get information, because information is powerful.
Yes, it is.
If we haven't left anything with you today, but to know that you need to reach out and you need to search, because it's your health.
Absolutely.
Okay. And that's the most important thing. So when you say that you love yourself, treat yourself like you really do.
Absolutely.
Don't let it just be words to say, I love myself and I do nothing to change. But if you keep doing the same thing, you'll get the same result.
Absolutely.
I guarantee you. So with ending today, I'd like to thank this wonderful panel that I've learned a lot from. I really am most appreciative of actually meeting new people. Sometimes it's hard to get out when you're out there and about and not actually just networking.
Absolutely, yeah.
And I thank you for allowing us to come today.
Thank you.
And Trending Tuesday, you guys are going to be here next year. Let's say I come back next year
Right.
and the year after that and the year after that.
Yes.
So thank you
Okay.
so much.
Thank you.
Okay.
You're welcome. Am I up? Okay. I want to say thank you. And my husband was preoccupied with a spider that was, so I finally stepped on it.
A real spider?
Yes, it was
Yeah, I remember
crawling around,
while I
and he
was
was. That's what he was
sleeping,
over there. He was
I saw it
ready
go
to.
across the-
You know, I kind of reached out. Stop. That's. Thank you, ladies. I can't imagine. I don't know about the few people that are live, but we're gonna tear it up on this podcast. You guys were fantastic, Dr. Bill, and I'm. This is my first time meeting the other two ladies, and like you, Dr. Bill, to meet new folk who are out and doing the things that you do, and you ladies have your own businesses and things like that. So that means you're really doing it and doing it good, right?
Yeah.
Okay. So we want to say we appreciate you.
Thank you.
Thank you for being that stellar that you've always been. And this is not an easy subject, you know. And
No,
you
it
steered around and you brought it back to suicide. We know it's Awareness Month, but
Absolutely.
you taking us along the way that hopefully we can veer off,
Absolutely.
you know, and not have it in that way. So I'm appreciative. My husband, you talked about food, and I didn't go real long. They didn't say that food would fix people, but my husband, organic chef, and for our guests here tonight, he's got a meal prepared, and it's all organic and healthy
Thank
for you. And we're gonna partake of that, and you know, whatever it is you'd like to drink for you, and for others that understand, we may have some hard topics. But if you come in and stuff, I promise you, you'll find it amazing, and then we'll feed you too when you're here. So we just want to say thank you, and as we close, the information that they gave you, those numbers, when we run it, we'll put it on the screen, okay? So that people can know where you are and how to get help.
Okay.
Okay, and I don't know, you want to talk about your meal real quick?
Actually, scan this.
I am. Of all the information that was dispersed tonight, you guys noticed the one number that she did not say call, and I'm so glad she didn't, was 911 to call a popo. As soon as you get out there, they tag you as at 5130 tag, and it's not just Sandra Mossy, it's so many stories of sisters that's elderly that needed some help, mental help. They called for the police. And it's one story. She says, "I rebuke you in the devil in the name of Jesus," and they just unloaded the whole clip just in the kitchen. So the police are the worst people at all to call ever. So any other resource that we've been given, 988, I remember that one. Put that one on the refrigerator. Will be absolutely helpful, so we can all kind of get through this journey of healing together. It takes a village. Okay. So as it pertains to health, body and health, soul and mind, I did some unique sockeye salmon and sauteed olive oil with a little bit of ginger and thyme, simply grilled. And we have some sauteed spinach with some fresh herbs as well, organic spinach. And we did some organic jasmine rice. And in about 3 minutes, the pinto beans will come out with a lot of love as well.
Awesome.
Enjoy.
Awesome. Thank you.
Good night. Good night.
Thank you.
We are lovers.